Health activist Dr Aslam Dasoo is a convener of the Progressive Health Forum. He joins us now. Very good evening to you, and thank you so much for speaking to us. Dr Dasoo, what is your reaction? Welcome respite?
Good evening. Well, in an ideal world, I would have preferred for the president to announce the complete rescinding of the Disaster Management Act and the doing away of all remaining restrictions. The president, unfortunately, has to rely on his institutions, for example, the Coronavirus Command Council, which was advised by the Ministerial Advisory Committee to do exactly that. But of course, they probably know better and advise the president accordingly. So I don't think he's been very well served at this time. I think when you listen to the management, from now onwards of 50% in stadiums and 200 people at funerals, 1 meter distancing except in schools, these don't make sense. The pandemic is not really evolved to the stage now which requires that. We understand this. Countries around the world have completely dropped restrictions. Namibia, Kenya, all of Europe. I think there is a growing understanding now that if you have high levels of immunity, and South Africa does, despite low vaccination rates, there's been a lot of natural infection, so a lot of natural immunity. It's come at a high cost because those who get infected and are not vaccinated, 80% of them end up in hospital make up the admissions to hospital and the majority of the deaths. But the fact is that we have high degrees of immunity right now. Omicron has signaled a step change in the pandemic. The fifth wave will come. We are sure of that. It will probably be just like the Omicron wave or most likely even milder. There is enough legislative capability as it stands right now, even without these new regulations suggested for the National Health Act, which actually don't take us very far. And there's sufficient legislative capability and there's sufficient power vested in the president, in the executive, to deal with any unlikely exigency in this pandemic in the future. That's done. We have to allow South Africa to start living a normal life again. Our economy is in tatters. We've just heard your analysts speaking about it. Our schooling has really taken a hit. What we think should happen is that it should stop being a communicable disease, that is COVID. It should now fit into the way we manage influenza and so on. Listen, masking is important, but you have to wear the right type of mask. Cloth masks do absolutely nothing. Are we glad that, of course, they're not forcing masking in public, in open air spaces where aerosol spread is just, it dissipates very quickly. This hand hygiene theater can come to an end. You can use alcohol for transmission of diseases that occur through contact. Not COVID. COVID is spread through aerosols.
You used a very interesting term in the beginning. You said, in an ideal situation. And that says to me, it speaks to the fact that there is still uncertainty that we have to contend with. The government itself and the management of this disease has to contend with. Omicron took a lot of scientists even by surprise, not only in its emergence, by its level of virility, even though it did not have such serious consequences for those who were infected, but just how quickly it could be passed on. That was unexpected. So in such cases of uncertainty, what kind of certainty do you expect government to give its people?
Well, I think the government has given the wrong message here. Let me explain again. Other countries have the same situation as us and have dropped restrictions. The biology, which the Command Council and many others seem to have a poor facility with, indicates that we are at a stage in the pandemic where these restrictions do nothing to mitigate its effects.
Okay.
We know that there has been high transmission with Omicron. We know that there will be a next wave. We understand this. What we have to do is, enhance our surveillance, which is already very good, and track this bug, and do wastewater surveillance, things like that. Give us a few weeks notice of an impending surge in a particular area and deal with it accordingly. You can't negotiate with a virus, which is what this government is now trying to do. Sorry, I should say what the Command Council is trying to do. And making these arbitrary distinctions between the size of crowds at a stadium and the size of crowds at a funeral is just absurd.
All right, thank you so much for your time.
It doesn't work. I think we need to move to the next level here. If that is a very difficult thing for the government in terms of its management of uncertainty, then it needs to listen to its experts a little more closely and not put in different agendas overlaying that.
Point taken. Thank you so much for your time. Much appreciated.